Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
An optometrist has been given a suspended sentence after she failed to spot a tumour behind an 8-year-old boy's eye. Vinnie Barker died in July 2012 after developing fluid on his brain. 35-year-old Honey Rose said she had done her best for the child during a routine eye test 5 months earlier, but the court in Ipswich found her guilty of gross negligence manslaughter. In a moment, should medical mistakes be criminalised? First, Paul McNamara reports.
The special little boy who is never coming home. That's how the parents of Vinnie Barker described their 8-year-old son who they loved so much. He was killed by a build-up of liquid behind the eye, a build-up of liquid completely missed by the woman on the left, Honey Rose, his optometrist. Vinnie Barker went to this Boots Opticians in Ipswich in February 2012. This picture of his eye was taken, which his optician never looked at. A key routine examination should have taken place, which never did. And 5 months later, this happy little boy was dead. During last month's trial, Mrs. Rose told the court that she had seen images she was wrongly told belonged to Vinnie. The jury didn't believe her. Their verdict? Guilty of manslaughter by gross negligence. Today, she would find out her fate. Before sentencing today, Mrs. Rose was told of a plea from the Barker family. Spare her jail. Mrs. Rose has 3 children herself, and the Barkers feared what impact prison would have on them. Honey Rose was sentenced to 2 years in prison, but suspended for 2 years, and 200 hours of community service.
Is there anything you'd like to say to the Barker family? The judge said that you tried to cover this up. The judge also said that the family made an application for you not to go to prison. Is there anything you'd like to say to the family? This sentence for manslaughter by gross negligence is the first of its kind for an optometrist. And Mr. Justice Stuart Smith made the point a number of times today that the mistakes made on that day were a tragic one-off for no good reason. But the implications, according to the defence barrister, have sent shockwaves through the industry. Just how can medical professionals go about their work when a single slip could mean facing prison? The police say that these fears are unfounded, and that this case was unique.
I think it's fair in cases where, as in this case, the standard of the duty of care, the standard of the eye examination in this case, fell far below what you'd expect of a reasonably competent optometrist. We're not talking about somebody that just made a mistake. The mistake she made was so poor, it reached the criminal threshold.
Healthcare workers like Dr. Jenny Vaughan are united in their grief over cases like Vinnie Barker, but fear growing use of the gross negligence manslaughter charge will not make things better. She is one of more than 4,000 signatories of an open letter to the Justice Secretary calling for a review.
The impact of all of these trials is huge. Everybody knows about them. And it's the fear and confusion because actually the distinction between gross negligence manslaughter and what is a medical error is not actually clearly defined. And this means that the normal healthcare worker going in about their daily job can get very fearful that this could happen to them.
There is much uncertainty as to the impact of today's sentencing. The Barker family say one outcome is unchanged: their life sentence of grief.
Well, the doctor who drew up that petition is Dr. David Nicholl, expressing concern over the use of manslaughter charges against individual healthcare workers when things go wrong. And joining me from his home in Hereford is Richard Stanton, whose baby daughter Kate died just 6 hours after she was born. An inquest jury unanimously found her death could have been avoided. Welcome to you both. Let me start with you, Dr. David Nicholl. Why did you draw up this petition?
Well, this particular area, in terms of what happened in this case, a child, I mean, absolutely tragic case, had a misdiagnosis of papilledema, and this is an area that I've worked on for some years, in fact, based on near misses, cock-ups, where things have gone wrong. And I've become quite troubled by this in the sense that we've actually measured this across a number of different hospitals, and we've been using essentially education to try and improve the assessment of patients neurologically. And my worry about a case like this, the kind of studies that I've done, would be next to impossible to do tomorrow, because all the data we used was all completely transparent. We named the hospitals concerned, even the results were very worrying. And you know, we're trying to use education to improve things. And I've also, you know, seen other cases where the, you know, coroners asked me to review the case, very similar to a case like this.
But in a case like this, why shouldn't doctors be held criminally liable if there is gross manslaughter negligence? I mean, you, after all, your expertise is that you can save lives, but also you can neglect the saving of a life if you're not doing a proper job. Why should you not be held criminally liable?
Well, anyone can make a mistake, and I think we should be learning from others, like the airline industry, and have what is meant to be a true, just culture, so that when errors happen, you report them, and in fact, you become culpable if you don't report them. The NHS is a million miles away from that, and we should be actually talking about errors, trying to learn from them. The actions of this kind of case today are actually going to make it much more difficult. People are going to be less willing to talk about error, and that kind of cover-up isn't healthy in the NHS.
Let's go over to Richard Stanton. First of all, very sorry for your loss, Mr. Stanton. Baby Kate died in 2009, and I gather that you are still looking for justice today. Is that right?
Perhaps not necessarily justice, but some accountability. Kate died in 2009 at the age of 6 hours, and it took us 3.5 years to come to an inquest, a jury-heard inquest, which found Kate's death was also avoidable, and that the Trust, the Royal Shrewsbury and Telford Hospital Trust, directly contributed towards Kate's death. Now, after inquest, we would have expected that the evidence that was uncovered there to be acted upon so that lessons could be learned and that care plans and policy could be altered so that this didn't happen again. But instead of learning, this trust chose, and they did choose, to reject the findings of Kate's inquest. So there was no learning, there was no accountability. As far as they were concerned, there was still nothing to see. So we took our case to the Parliamentary Health Service Ombudsman, and 2 years after they took it on, they returned and upheld our complaint in full and found this trust guilty of maladministration and issued them told them that they had to apologise to us. Now, I hear that very, very clearly the message that there will be a reluctance amongst clinicians and consultants and those that practice in the medical profession to come forward, but if mistakes are made. But that couldn't be further from the truth in the terms of Kate. This trust was afforded every opportunity to tell the truth, and midwives' statements were rewritten. As I say, the Parliamentary Health Service Ombudsman found them guilty of maladministration. And it wasn't until last year when...
Right, go on.
Sorry, Matt.
Just finish your point.
And it wasn't until last year when two independent investigations undertaken by NHS England actually forced this trust to look at itself and to look at its policy and to uncover the real truth behind Kate. During that time, there was also a West Mercia police investigation going on that me and my wife Rhiannon had instigated into whether corporate manslaughter or indeed gross negligence manslaughter could be looked at and whether the CPS would bring charges under that.
So basically what Richard is saying there is that the system cannot clean itself up. You've got to go to another level. You've got to go to the criminal level in order to hold individuals accountable for their gross negligence.
I understand, and I'd agree that we're talking about some of the most difficult areas of medicine, and you know, like has just been said, the tragic kind of cases basically. But often, when you look at these kind of errors, it's often system errors that happen. It's very rarely that an individual comes in and causes harm.
But isn't that the easy excuse? It's the system that's to blame and not the individuals, because you're never going to get to the kind of justice that Richard wants.
If you speak to people like Martin Bromley, aircraft pilot whose wife died in surgery, he recognises that he gets this, that actually it's often many factors that are involved in that. And true negligence is not learning from error. All of us can make a mistake.
OK. Richard, does that satisfy you, the answer you just heard from David?
Well, I would totally agree that the true tragedy of anything where somebody has either been harmed or killed by medical negligence is that the learning within the system, within the trust, doesn't go ahead to prevent this kind of thing from ever happening again. But here we had, in terms of Kate's case, yes, we had individual clinicians who failed Kate so woefully, but then we also had a management cover-up that added to that and impounded on mine and Rhiannon's grief at a time that was incredibly difficult for us. And it wasn't until the West Mercia Police became involved that truly triggered them to focus a little bit more on themselves. I mean, here we had a trust that had no operational policy for any of its midwife-led units from the time of 2009 up until November of last year, and they would have still had no policy for their operational policy for their ML units had it not been for the intervention of a deeper investigation.
Right, let's just get your reaction to that, David.
Well, it's difficult also when we're talking about different conditions, but I think there are other ways of dealing with this. For example, in New Zealand, different compensation methods that don't have the aggressive, punitive kind of legal system that we have here, which often focuses on an individual and actually don't deal with the system errors.
Okay.
I have to interject that we're not looking for compensation. I think there's this cultural view that somehow that anyone that has been harmed, or a family or a loved one that has had this compounded upon them because they've lost or had a child or a loved one harmed through medical negligence, is looking for compensation.
Very rarely.
We're not. We're looking for learning, and
Absolutely.
we're looking for the lessons of accountability to bring about learning.
All right.
And unless we learn from when a tragic event happens, then I'm afraid there's going to be an awful lot more of this happening.
Okay, this could go on and on, but I'm afraid we've got to leave it there. Richard Stanton, David Nichol, thank you very much indeed.
Thank you.
I've been getting away with it all